Good morning, everybody, and welcome to this press briefing by the European Centre by Disease Prevention and Control. Today, we will be discussing the latest data for two mosquito-borne diseases that are increasing in the European Union, dengue and West Nile infection. We will also release reports on Zika and chikungunya after the briefing has ended. Please remember that this is being recorded and it will be made available on ECDC's YouTube channel after it has finalized. My name is Andrea Nilsson, and I have with me Dr. Andrea Ammon, ECDC Director, and Dr. Celine Gossner, who is a principal expert on emerging and vector-borne diseases. Dr. Ammon, the floor is yours.
Thank you, Andrea, and good morning from my side. And thank you for joining us here today for the press conference. In recent years, we have been seeing increases in the number of locally acquired cases of dengue and West Nile virus infections, particularly in southern European countries. And we also see more regions affected each year and for longer periods. So climate change is expected to extend the mosquito-borne disease transmission season by creating more suitable conditions for mosquitoes to thrive. This means that the season starts earlier and finishes later in various parts of Europe, hence increasing the period when we can observe cases and potentially also increasing the number of cases. We are already seeing signs of this happening. Additionally, the number of imported cases of dengue is rising, particularly due to the large outbreaks in the Americas. In 2023 and the first months of 2024, we observed a striking increase in the number of imported cases of dengue. My colleague Celine Gossner will give you more details on as well as an overview of the public health measures for controlling the spread of mosquito-borne diseases. But first, I would like to give you an illustration of how the most important mosquito species transmitting these diseases and spreading into new areas in Europe. So basically, we have three mosquito species we are talking about here. First is Aedes albopictus, also called the Asian tiger mosquito. And it was first reported in Albania in 1979 and has established itself in many countries in southern and central Europe. It is known for transmitting dengue, chikungunya, and Zika viruses, and is spreading further north, east, and west in Europe. Warmer temperatures and milder winters in Europe have created more favorable conditions for the survival and reproduction of Aedes albopictus. This has contributed to its spread into areas that were previously too cold for the mosquito to thrive. Increased international travel and the transportation of goods have been major pathways for the spread of mosquitoes across borders, particularly through trade in used tires and bamboo plants. In addition, urban areas provide ideal breeding sites due to the abundance of artificial containers that can hold water, such as flower pots. Now, the map on the left that you see shows the situation in May 2014, when the mosquito was established in 8 EU EEA countries, affecting 114 regions, and these are the regions in red. Now, on the right side, in 2024, 10 years later, it has established itself in 13 countries and 357 regions. Over the last year, we have seen new introductions and establishments occurring in several regions, with 5 regions where the mosquito has been newly introduced. That's Spain, Netherlands, Portugal, and Slovakia, and 7 regions where the mosquito has been newly established, in France and in Germany. So, and here, introducing means that the virus is introduced from the outside and it may disappear. Establishment means that the species has a self-sustaining population there, putting these regions at risk of local outbreaks of dengue, for instance. As of this year, Aedes albopictus is established, so there to stay, in Austria, Bulgaria, Croatia, France, Germany, Greece, Hungary, Italy, Malta, Portugal, Romania, Slovenia, and Spain. And it is introduced in Belgium, Cyprus, Czechia, the Netherlands, and Slovakia. Now, another mosquito, Aedes aegypti, is a known vector of multiple viruses that causes diseases such as yellow fever, dengue, chikungunya, and Zika virus diseases. The mosquito was once widespread in Europe, but disappeared in the 1960s. At a press conference last year, we mentioned that it had been established in Cyprus, and we now also see that it has again been introduced in the Canary Islands, where it was already introduced and subsequently eliminated a few years ago. Cyprus has taken a comprehensive approach to combating Aedes aegypti through a combination of vector surveillance, targeted vector control measures, public awareness, and community engagement efforts. Its re-establishment in Europe is concerning due to its significant ability to transmit pathogens to a susceptible host and its preference for biting humans. So that comes now to the last mosquito. That is a map of the Culex pipiens mosquito responsible for the spread of West Nile virus. This species is native to Europe and is present throughout Europe as seen in the map above. Now, while dengue is primarily an imported disease in the EU, there has been a noticeable increase in locally transmitted cases. Since 2010, which is when the first recent outbreak was recorded, 48 vector-borne dengue, 275 cases have been detected. We observe an increase in the number of outbreaks and the size of these outbreaks, and especially so in the last 2 years, as you can see on the graph on the left side here. Between 2010 and 2017, there were up to 3 outbreaks per year, and there were 5 outbreaks in 2018, 7 in 2020, 10 outbreaks in 2022, and the peak so far was observed last year in 2023, with 8 outbreaks in France, 4 in Italy, and 2 in Spain. And if you look at the number of cases in 2023, there were 130 reported locally acquired cases of dengue, compared to 71 cases reported in 2022. The total number of cases locally required in between 2010 and 2021 was 74. So basically, we have 74 cases in the years between 2010 and 2021. We have last year a significant rise, and 2022 a significant rise, and also in 2023. So in 23, we had also 742 reported human cases of West Nile virus infection, and most of them, 713, were locally acquired in 123 regions in 9 European countries. 22 regions were reported as a place of infection for the first time, and 70 deaths were reported. This number of cases last year was lower than that of 2022, but the number of affected regions is the highest since the peak in 2018. And this indicates a wide geographical distribution and circulation of the virus. So in conclusion, ECDC will continue to evaluate the risk to EU EEA countries of emerging vector-borne diseases, including those transmitted by mosquitoes. When appropriate, we will issue risk assessments on outbreaks occurring in Europe or EU outermost regions. We will maintain regular surveillance of vector-borne diseases and will provide overviews of the epidemiological situation. This enables countries and the European Commission to take informed actions to minimize the impact of these diseases at both national and European levels. So thank you, and I hand now over to my colleague Celine Gossner.
Thank you, Andrea, and good morning. So if we look at the number of imported cases of mosquito-borne diseases, we see that they are on the way up after a marked decrease in 2020 and 2021, which was due to the global travel restriction implemented during the COVID-19 pandemic. In 2022, there were 1,572 imported cases of dengue and over 4,900 cases in 2023. This is the highest number of imported dengue cases reported since the start of the surveillance at the EU level in 2008. In comparison, before the pandemic, the highest number of imported cases was in 2019 with 3,460 cases. The high number of imported cases of dengue in 2023 was reflecting the global situation that year. Between 2015 and 2022, there were on average 2.2 million cases of dengue reported globally to the World Health Organization each year. In 2023, there were 5.2 million cases, so more than the double, the majority of them reported in the Americas. So we see that large outbreaks of dengue in the Americas and in other regions resulted in an increase in imported cases. In the first months of 2024, we observed two important facts. First, the number of dengue cases in the Americas is above what we have ever seen, with more than 7.5 million cases reported as of April. Secondly, we have observed an unprecedented high number of travelers arriving from dengue endemic countries to Europe in the first 3 months of 2024. So if we take the 20 dengue endemic countries or EU outermost region, from where we have seen the highest number of imported cases in the past years, and we look at the number of flight passengers or travelers that arrived in continental Europe from this place, there were 5.7 million travelers in the first 3 months of 2024. In comparison, there were 8.1 million travelers in 2023 and 9.3 million in 2019. So this means that in 3 months, we observed more than half of the volume we observed during the previous years. And we do not have an explanation for this increase in number of travelers, but we are investigating what could be the reasons. And despite we do not have yet the data for the last 2 months, we expect to see similar numbers. As a result of these two facts, there has been a marked increase in number of imported cases in Europe since the start of the year. And as the summer arrives in Europe, it is of concern to see so many cases, which introduced the dengue virus to Europe. And while there is no direct relationship between the number of imported cases and the number of local outbreaks and their magnitude, it is safe to say that the more virus introduction there are, the higher the chance to see an outbreak. And as we all know, there will be the Olympic Games and the Paralympic Games, which will be held in Paris and other French cities this summer. And these have been identified as a significant risk for disease transmission, with 16 million travelers expected to arrive. So Paris is geographically less at risk than other areas in Southern Europe in terms of mosquito-borne diseases. Nonetheless, the situation is monitored very, very closely by the French authorities. When we speak about mosquito-borne disease, we often refer to the transmission season, so mosquito activity season or disease transmission season. And in Europe, it typically lasts from the late spring to early autumn, so June to October. But earlier this year, a locally acquired case of West Nile virus infection in a human was reported in Seville province in Spain. The symptom began in March, which is unusually early for transmission. This early occurrence is likely due to the extraordinary mild weather in the late winter that favored the early mosquito activity. And there were also evidence of West Nile virus transmission among equids at the end of last year, very late in the year, which indicated a prolonged transmission season. Again, very likely due to the suitable climatic condition. So such an extended mosquito season is now actually expected to become the new normal. If we look at the public health measures to effectively combat mosquito-borne diseases, we need to take a comprehensive approach. And I will present 6 main work areas. First of all, we never say it enough, but individual protection against mosquito bite are essential. So travelers going to tropical and subtropical region should protect themselves against mosquito bite and use mosquito repellent. And it's equally vital that they continue using mosquito protection upon their return for a duration of 3 weeks if they reside or visit areas where the Aedes mosquito is present. And this is to reduce the chance of having secondary transmission in case they are infected. And of course, wearing long sleeve pants, using bed nets, windows and door screen, air conditioning, fan will also provide significant protection. The second area is vector control. So when mosquito density is very high, the fastest way to reduce the density is to apply adulticide, such as spray-based peritonirid or organophosphates, which will kill quasi-instantaneously adult mosquitoes. This method carries actually an ecological cost. So to prevent having high mosquito density, it is important to eliminate or alter mosquito breeding sites. For example, eradicating standing water in containers, flower pot, buckets, or tires. And if water storage is necessary, the container should be sealed or tightly covered. And larvicides can also be used in large water bodies like ponds, and this will impede larval development, meaning that the mosquito will not be able to develop from the larval stage to the adult stage. I would also like to mention one method that we could consider to be more innovative, and that's the sterile insect technique. This technique is not new. It was developed in the 1950s and has been used for decades to manage agricultural pests, such as the Mediterranean fruit fly, for instance. This method showed very good results in the fight against Aedes aegypti in Cuba and Aedes albopictus in China. And it is now used for the first time in Europe to eliminate Aedes aegypti from Cyprus. The technique consists of releasing a large number of sterilized male mosquitoes. The sterilization is done through irradiation. This sterile male mate with the wild female, resulting in no offspring, which over time reduces the mosquito population. And I would like to emphasize that no vector control approach is efficient on its own. It's the combination of action that will show result. Also, the community adherence is pivotal for the success of this measure, as it necessitates active involvement of the population. The third point is that ensuring early detection of the case is imperative. So the prompt detection serves to mitigate the risk of further virus transmission, for example, for dengue virus, but also a proper case management. The fourth point is that timely surveillance is extremely important because it facilitates the continual risk assessment and the application of control measures, including vector control measures. Also, both dengue virus and West Nile virus can be transmitted through transfusion or transplantation of substance of human origin, such as blood, tissue, cells, or human organs. And measures to prevent the transmission of this pathogen through substance of human origin include, for example, the temporary deferral or the laboratory testing of donors that have spent time in areas where these vectors circulate. So surveillance data can therefore inform authorities in charge of the safety of substance of human origin. The fifth point is that further research is necessary, and this to develop rapid diagnostic tests, treatment, vaccine, and cost-effective, eco-friendly mosquito control technique. And I would like to mention that there are 2 dengue vaccines that have been approved for marketing in the European Union. However, these are intended to resident in highly endemic areas, and therefore to date, they are not part of the toolbox to prevent or control outbreaks of dengue in continental EU, where dengue is not endemic. Additionally, there is no vaccine currently available to prevent West Nile virus infection in humans. And the last point, it is paramount to raise awareness among general public, health professional, travelers regarding mosquito-borne diseases. And this includes the dissemination of information on symptoms, transmission, personal protective measure, vector control method. And you as journalists hold an important role in that. Thank you very much.
Thank you very much, Andrea and Celine. Now we open the floor for questions. Please remember to use the raise hand function or write them in the chat and we will give you the floor. Please also turn on your cameras when you are given the floor. I see that we have a question from Alicia from Europa Press. Alicia, please go ahead. Okay, Alicia, I will read the question. What the situation is expected to be like in Spain? How the impact of climate change on mosquito-borne diseases will be? Would you like Andrea to take this one?
I think it's of course difficult to exactly predict, but I mean, as we have explained, the combination of warm weather and still having some standing water pools is a good prerequisite for having mosquitoes in higher numbers. Now, what we have to make a distinction, though, is one thing is to have the mosquito, the other one is to have an infected mosquito. And I mean, Spain is one of the countries where dengue is established. So the possibility that a mosquito that is found there is infected is given. So the recommendation are, as my colleague Celine has said, that that the population needs to be made aware of the possibility of such diseases, and also what they can do themselves to prevent becoming infected, and also what they can do themselves to control the vectors. Would you like to add?
Yeah, maybe I can just clarify that it's Aedes albopictus that is established. Dengue is not established yet, but since the mosquito is present and is abundant in large part of Spain, there is there will be importation of the virus, and the environmental condition in the summer are suitable for local outbreaks. So, I mean, the conditions are there to see outbreaks during the summer. Now we cannot predict if it will be no outbreaks or multiple outbreaks. So this is something that we really cannot predict.
Thank you very much. Now we have Patricia from Publico. Patricia, please go. We cannot hear you.
Is it okay now?
Yeah, now we can.
Okay, good morning, thank you. I am calling from Portugal, and the question is a little bit similar to my colleague from Spain. Do you have any prediction or any expectation for how the year will be in Portugal? And is there any campaign that will be made? Or are you recommending the national diseases control systems to have a campaign for people to be aware of what's going on? Is there any conversation about this, any recommendation? Thank you.
Thank you, Patricia. Celine, do you want to take this one?
Yeah. So again, it's difficult to predict what will happen in Portugal this summer or in the coming years. But the mosquito is established in more and more places, which make more and more areas suitable for transmission of dengue. In terms of campaign, I mean, we are in constant discussion with our national focal points, so the public health authorities, national authorities in the country, to see how to do the best surveillance and how to best respond to outbreaks in the different countries of Europe. So, and they are very much aware of the risk. So I think they assess the situation and assess what needs to be done in the country.
Thank you, Celine. I don't see any more hands raised at the moment, so we will take one question that we received offline, and this is for Celine. Are there vaccines available for Zika, chikungunya, and West Nile infection?
So there are no vaccine for West Nile virus infection in human. There are vaccines for West Nile virus infection in equids, but not in humans. For Zika, there is a vaccine that is in development. And for chikungunya, very recently, the European Medicine Agency has recommended granting marketing authorization of the first chikungunya vaccine in Europe. So this recommendation will now went to the European Commission, who will decide whether the vaccine can be marketed in Europe. And then it will be to the national authority to decide what would be the pricing, what would be the use of the vaccine. But this is a great development for the fight against chikungunya in Europe.
Thank you, Celine. I don't see any more hands raised at the moment, nor comments. Okay, we have Joseph from La Vanguardia. Please, Joseph, go ahead. We can't hear you.
Now, I think now it's okay. Can you hear me now? Hi.
We can hear you. Go ahead.
Okay, perfect. Thank you. I just wanted to know your opinion about how do you think this evolving in the next few years? Is there any possibility that this upward trend in the expansion of mosquitoes able to transmit diseases will be reversed and going back, or are we to expect an increasing trend in mosquito-borne diseases in the next few years in Europe? Thank you.
Thank you, Joseph. So your question is about the trends and whether we will continue to see them evolving or if they will be reversed in the coming years. Andrea, would you like to take this one?
I start. So the tendency that we have seen signals that we will still see an increase in the coming years. But of course, this is a very complex development that's connected to the rising temperatures, and we will have to see how this further develops. But I mean, what we can see that there is a connection between a higher temperature in summer, milder winters, and the spread of the mosquitoes further in areas where they're not present right now. So that is something that we would expect. Now, as Celine has said, there are, of course, measures that we can implement and prepare in terms of surveillance, meaning detecting, not in surveillance, not only in human cases, but also in particular in vector surveillance, so that we know the spread and can link that to awareness campaigns in the population in these areas, both for their own protection, but also on their contribution to vector control efforts. So that is something that certainly can be done. Whether this will be sufficient to really turn the tide and stop the trend, I am not sure. Celine?
Yes, I mean, stopping the spread of Aedes albopictus will be quasi impossible because the mosquito is transported in by trucks, cars, so it will be extremely difficult to really stop that. And we see that the environmental conditions are suitable on a longer period. So I think the trend that we are seeing now with new areas that are affected will probably continue. For West Nile, it's different because the spread of the virus is not linked to the mosquito spread. As you could see, the mosquito is already about everywhere in Europe. It's more linked to the suitability, the climate suitability with the vector, but also the movement. And this will also be very difficult to stop. So that's why the measure that we presented earlier will be very important to try to mitigate the density of mosquito, to try to reduce it to a certain level, so that at least we will not see large outbreak and propagation of the virus. So yeah, we have control measure in place and measure also to monitor the situation, and we should carefully follow up on that.
Thank you, Celine and Andrea. Let's give a few seconds to see if there are any additional questions. Okay. There are no further questions, so I would like to close this press briefing. Thank you very much for your interest and thank you very much for joining. Please do not hesitate to reach out to us if there are any further questions or comments on press@ecdc.europa.eu. Thank you very much, and until the next time. Bye-bye.